what we tell our clients and families is that let us come in and be the caregiver so that you can be the family. There's something called caregiver burnout that is so real. And what happens is that you'll have a family member that's caregiving that then over time becomes sick themselves from the burden of caregiving. And so what we tell families is let us come in and take that off of you so that you can have, especially when it's an end of life, issue, so that you can have that time together being the wife or being the adult child or and we'll come in and handle all the caregiving.
Hello, ladies and gents. I'm Glenn, aka Nurse Dad, former Navy Hospital Corpsman and current ER nurse, and welcome to my channel. The seeds of this interview began on Instagram, believe it or not. I started following a particular hospice nurse who was really intrigued by her level of compassion and expertise. Her name is Amy Pierce, and together with her husband Scott, they own Coastal Care Partners based out of Savannah, Georgia. What does Coastal Care Partners provide? They provide aging care solutions, but what is that? Well, I'm going to approach that question with an example that I see is becoming all too common in the hospital. I can't tell you how many times over the years I've gone into the patient exam room after the physician has departed, leaving them with the discharge paperwork, having given them the instructions to ask, hey, do you need anything? Because, maybe the patient needs a wheelchair, or maybe they want like an extra bottle of water or whatnot, only for the patient or the patient's family to look at me and say, could you explain what the doctor just said? I mean, nowadays I kind of expect it, at least, 50% of the time, which is kind of crazy, right? I don't know what it is that makes many patients and their families not seek clarification from the physician. The physician typically does explain things at an elementary level, but maybe people don't want to feel foolish, and I get that. And it's not their fault. Medicine is a language, even if it's presented in its most basic form. And there's a lot going on inside the minds of these patients and their loved ones. There's a lot of emotions going on. There's a lot of sometimes conflict of interest depending on how their lives are or which specialists they're being directed to. They might have just been given like a whopper of a diagnosis, and just that alone, just the week or two that they need to grasp that, and then you try to give them a treatment plan to follow, that's tough. So I understand this. And Amy and Scott certainly understand this, and this is why they started Coastal Care Partners. Now, in the interview you're about to watch, Amy and Scott do a much more thorough job explaining what their company does. And of course, please like, share, and subscribe, and comment if you can. It lets the algorithm know that Nurse Dad is worth promoting, and not just for getting this channel out to people who might find it entertaining, but getting it out to those individuals who could really benefit from this information.
Don't make me beg.
So without further ado, let's kick this pig. So I want to thank you, Scott and Amy Pierce, the owners of Coastal Care Partners in Savannah, Georgia. Amy, you're a nurse. What type of nurse were you?
Sure. I've been a nurse for over 20 years. I've worked in a lot of different areas, from the hospital setting, the ambulatory surgery centers, to doctor's offices. And I spent a good bit of time in the hospice world. I worked as a hospice admissions nurse for a company here in Savannah locally, and it was just such a wonderful experience. I love all the holistic, parts of hospice work. And, hospice is amazing, and they offer so many wonderful things. But what I saw when I was being a hospice nurse every day is I saw older adults and their families just struggling to deal with complex health issues and this new diagnosis. And what if they're not hospice eligible? And they needed a lot more. And at the same time that I was seeing all of this professionally, my husband, Scott, was seeing it firsthand with his own parents.
Mm-hmm. Yeah. And it was just something that we both encountered in separate ways at the same time. My parents were in their 80s. I was living out of town back in 2016. And my parents were just at that point of life where they no longer could really effectively care for themselves. And since I lived out of town, I was visiting them here in Savannah, and I was talking to Amy. I said, what am I going to do? There's nobody here to help care for my parents. And she said, hey, I get it. That's the situation that I see every day in hospice, with families struggling to understand how to put in effective care for their aging parents.
And we said, there should be a company where you can hire somebody with medical background and experience to come in and just navigate all of it and say, you know what, I'm going to help you. I'm going to take this on. I'm going to be the quarterback of your healthcare team. And I'm going to help, get you to all of your important physician appointments and help you understand all of their instructions, help you implement that back home. And when you have adult children that live out of state or even here that are busy, I'm going to help explain everything to them that's going on and sort of be that in between for them. And so we launched Coastal Care Partners here in Savannah around 6 years ago, and it just took off.
That reminds me of a story from a nurse. She had to relocate to Florida because both her parents were in that stage, and her mother was just not as reliable for taking care of her father. From my experience, I'm thinking, yeah, my parents live a couple of towns away, but for a lot of people, they're not even in the same state as their folks. Would you describe it as nurse consultations? How do you describe that role?
Yeah, so we call it nurse care management. And a nurse care manager, I tell people, if you think about when you go to the hospital, there's a nurse case manager for the hospital floor that's kind of helping you navigate next steps after your hospital stay. And they're doing it for the whole hospital. What we do is private nurse care management. It's very relationship focused, very one-on-one. Each of our nurses has a caseload of about 8, 9, 10 clients that they're caring for. They take their clients to all of their physician appointments. If you think about it today, many older adults have multiple physicians. They'll have a primary care doctor. They'll have a pulmonologist. They'll have a cardiologist. They're going to have an orthopedic doctor sometimes. They're going to need cataract surgeries. And every one of these specialists has different instructions for them, different medications that they're prescribing. And it gets complicated for them to keep up with all of that. And especially nowadays, 50% of people over 85 years old have some level of cognitive decline and issues. And so when you're dealing with all of that, trying to keep up with all the appointments, it's really tough. And so what we do as a nurse is we come in and we navigate it for them. We take them to those appointments. If they're one of the really cool things that we're able to do is keep people out of the hospital, which, hospitals can be one of the most dangerous places for an older adult to go into. And so keeping them out of that hospital when it's appropriate is great. I mean, we know what a urinary tract infection looks like, what it's going to look like coming on. And by seeing them frequently, we can prevent that without the need to go to the hospital. So things like that.
You touched on a question I was going to ask later. You try to keep the same nurse with the same clients? Because even from my own experience, I had dabbled in a similar field, and it was kind of sold to me as that. And then when I got there, it became, well, whenever a text shows up, some random person somewhere, whether it's in the city or anywhere on the island, Long Island, that is, look for the text. So they really, for this company, it was whatever nurse responds first and can show up there for the patient. But sounds like you try to keep the same providers with the same clients.
Yeah, absolutely. So our nurses get assigned their number of clients, and it's the same client. So they really have a very close relationship with the client, and it's their personal care manager. And so, I mean, that nurse literally has their schedule for them and knows where they're going to go. And it's medical. It's a huge piece of it's medical, but there's also like life management as well. And so our nurses just help them with everything that's going on here, which is really helpful when adult children live out of state.
Yeah.
Right. And it sounds like from the nurse's point of view, they can expect like a more defined schedule to plan their lives around, because they're sticking with a certain amount of clients, and they know in advance where they're going, obviously, because sometimes you're waiting a month, or you have one appointment in 3 weeks and another one next week. So it sounds like the nurses can expect a schedule to go by.
Absolutely.
Yeah, it's really neat for the nurses because it does give them more flexibility. It's funny, we do get asked the question a lot by nurses that come to us. They say, hey, I just want to work Tuesdays and Thursdays, or I want to work Monday, Wednesday, Friday. And we say, that really doesn't work in this environment, because if you say you just want to work Monday, Wednesday, Friday, and your patient needs you on Tuesday, it doesn't work. It's not the model that we're building. We're really building that one-on-one relationship. So we sort of tell the nurses, it's great if you only want to work 10 hours a week, we'll give you 2 or 3 patients, right? If you want to work 40 hours a week, we'll give you 10 or 12 patients, because it works as an active care management program. We don't consider ourselves a break glass in case of emergency kind of thing. We're not sitting in the background waiting to be called on. We're actively managing these patients. The nurses are going by, laying eyes on them, a couple times a week, make sure the house is in order, how you feel, and everything's great. No appointments today, so next appointment will be Tuesday. Call me if you need anything, and then they'll go from there. And we've had patients that stay with us 4 and 5 years, and they've been with the same nurses. And it's just been a really rewarding, service for us to build. And I think very rewarding for our clients.
It really gets back to what a lot of us went to nursing school to do. Because, as things have changed with the insurance-driven models of today, healthcare is broken. And nurses have to see way too many patients, and they are not able to build that relationship. One of our wonderful nurses was an ER nurse for 19 years at a local hospital here. And she talks about how, a long time ago, she was that nurse that would come into the ER and wash the feet of the homeless people that came in. And then it got to the point where she was no longer able to do that because of how many patients she had to see.
The hospital actually told her, sorry, you don't have time to do that. It's nice, but
you can't. And so, but what she said is that once she transitioned over to Coastal Care Partners, it was getting back to what she went to nursing school to do.
Activities of daily living and hygiene. You also mentioned trying not to have the patients stay in the hospital as much. And this is a myth I tend to bust for people, is that, the hospital is not the cleanest setting. Often, we'll stick with geriatric patients, obviously, just even if there's nothing acutely wrong, if they stay in a hospital, there could be an altered mental status that occurs just because they're not in their typical environment, so their parents might have to get a phone call saying, your mother is exhibiting, signs of altered mental status. A lot of times a patient will be admitted because they want to do 24 hours of just IV antibiotics. What mechanism is in place to stay with the patient, or maybe to administer those medications at home?
Yeah, that's a great question. So both of those things, if there is a necessary hospitalization, that our nurse care managers, they manage that hospital stay. And what that looks like is, we also have another component of Coastal Care Partners where we have in-home care providers. So we have CNAs and PCAs that help with things like ADLs. And our nurses can bring in our caregiving component to actually have caregivers stay with them, overnight and throughout that hospital stay, like around the clock. And then the nurse is also going into the hospital as an advocate. And, just making sure that everything's going as it needs to go, because the nurses in the hospital are wonderful. The doctors in the hospital are wonderful. It's just, they're all overwhelmed because there's so many patients there. And, since COVID, that's only gotten worse. And so, our nurses go in as advocates to just manage that hospital stay, bring in caregiving when that's necessary. And then the discharge planners actually love Coastal Care Partners being involved, because it makes their job easier, because we navigate a discharge plan.
And make sure that there's not the boomerang of a readmission, which we know hospitals hate. So if the discharge planner knows that they can hand off their discharge instructions to a competent registered nurse who's going to manage that process, they can feel pretty good that the readmission isn't going to occur.
I know from like I am an ER nurse, and it is night and day the difference in having a patient with an aide
Mm,
or some kind of advocate. Because as an ER nurse, I'm more concerned, I'm operating in terms of triage. So if I'm having chest pains come in or anything that comes that could be life threatening, the little things just are not even on my radar. But the little things at that level that you're speaking of mean so much. The aide will always be like, "Hey, can I get, like a toothbrush, or
mhm.
can I get like some more water, or is the food ready, or can you help me adjust the bed?" It is night and day the amount of detail that's paid attention to, or just checking up. Hey, is that bed ready? For admission to upstairs, or it's such a big difference, even in terms of a patient if you're able to be cared for at home as opposed to maybe a nursing home. I know that if I get anyone from, especially a state nursing home, one of the first things I'm doing is checking their skin. I'm just not
Mhm.
Sure.
expecting the level of care that maybe someone has received privately at home. I can certainly attest to the difference in having an advocate or an aide close by to walk the patient through their care.
Absolutely. And you nailed it because, we tell our clients that the hospital experience is not what it used to be. And so it's so valuable to have both the caregiver and the nurse through that hospital stay with them because I mean you nailed it exactly. They can run and go get the nurse if they need more pain medicine. They can run and go get,
Yeah.
ice chips or whatever it is and just help that experience go a whole lot better.
It doesn't sound important, but it really is the bread and butter of care. Certainly, that's what people complain about the most. As a
Yes.
nurse, you could do so many interventions and just be like, all right, I got that, sepsis came in, I got the ceftriaxone, I got the Rocephin, the Venco, I got the IV Tylenol running, I got everything going, what's complained about is perhaps maybe you were late with dinner, or
Yeah.
someone
Yeah.
Yes.
had to wait a long time for that ice, or didn't, or maybe the physician's so busy, nobody's communicating with the patient, and yeah, that's really important. Who are the types of people that reach out to your company? Is it your potential clients, or is maybe the relatives of your clients?
That's a great question. So we see a mix of both. We have the older adults themselves that will call us. Sometimes a female will call about her husband, about care for her husband, or a lot of times the adult children call. So we're in Savannah, Georgia, and an adult child living in New York or Ohio or Colorado might call us and say, "Hey, listen, mom and dad live here in Savannah, they're not doing great and they need some help." And so oftentimes we're called in by the adult children
And
as well.
especially we just came out of the holidays a month or so
Mhm.
ago. So, right after the holidays, we get a lot of phone calls from, kids saying, "Hey, I was down visiting, mom and dad. And then
Mhm.
I walked through the house and I noticed that I opened the
Mhm.
refrigerator and, the food was probably
Expired.
6 months expired. And I've
Yeah.
never seen that before. And bills were piling up on the kitchen table. And I asked my parents about it. They really couldn't answer well. And
Mhm.
so those are the clues that
Mhm.
tip the
Mhm.
kids off that it might be time for somebody to help mom and dad.
And in a conversation that we were having offline, um, the benefits of having an aide. Somebody in our family, their wife was unfortunately, she was diagnosed with a terminal cancer, and her husband thought it would be better for the children, to take care of their mom through that situation. And it turned out to be a pretty negative experience, because children really can't fulfill the role of nurse as well as a nurse, and they're kind of seeing a lot of the ugly side of caring. And perhaps if they had had an aide, taking care of their mother, doing, what nurses do, they would have been able to better enjoy, those last days or last months with their parent, not having to worry about taking care of this or taking care of that. What is your thoughts on something like that? Is
Absolutely. Yeah, absolutely. We see this a lot, and what we tell our clients and families is that let us come in and be the caregiver so that you can be the family. You know, there's something called caregiver burnout that is so real. And what happens is that you'll have a family member that's caregiving that then over time becomes sick themselves from the burden of caregiving. And so what we tell families is let us come in and take that off of you so that you can have, especially when it's an end of life, issue, so that you can have that time together being the wife or being the adult child or and we'll come in and handle all the caregiving side.
And we see, there's a lot of emotions tied to that with the family, right? The kids or the spouse could feel guilty. It's my job.
I was about to say that guilt.
Yeah, exactly. It's my role to do this. It's my responsibility. But then what we see time and time again is it can, result in resentfulness. And, even if it doesn't percolate to the top, it's in there. And, like Amy said, caregiver burnout happens. And especially with
nurse burnout happens. So certainly
yes,
caregiver
absolutely. Right.
Yes.
I mean, so it's across the board. But yeah, especially the spouse, we'll see that we'll get a call occasionally. Sometimes they'll call early, sometimes they'll call late, and just and we'll have to go in, and the spouse is just at their wits' end, and we're like, all right, we can help with this. But yeah, we do definitely see that.
Yes, Scott, you again, you guys keep touching on things that I'm thinking about for later, but the resentment part, it is a very nuanced and complex array of emotions that you go through taking care of your parent. And I've seen it just when a lot of times in my opinion, when children are the caretakers, things don't get taken care of as expediently as they need because obviously things aren't recognized. You'll just see skin issues that are as bad as they can be, or you'll see maybe a new development occurred that just wasn't caught when it could have been caught, and you'll see people in the room with their loved ones, and it's a mixture of they feel so bad for their loved ones. They're also resentful. I mean, if you have your mom or dad going through Alzheimer's and they're spending their nights just trying to climb out of the bed for 6, 7, 8 hours and clawing at you, and I mean it's tragic to watch. I've commented about this on another video. You feel bad. You feel love for them. You also resent them for acting that way. And it's not their fault, but there's just such a wide array of emotions that you're going through that aren't enjoying the last days or last weeks or months of your loved one, because you are taking on the responsibility of caretaker, and it's not like taking care of children. It is. There's good days. There's bad days. It's very trying, and my heart always goes out to the children when they're in the room with with my patients, because they don't have that nurse advocate. I mean, they have me, but I've not been there. I don't really know them. And what you're offering is somebody to translate what the doctor is saying. I've said this before. I'll go into a patient room after a doctor leaves, and the patients will ask me and the family, what did they just say?
Yes.
There's like this hesitance to ask questions, or maybe they feel like it's a stupid question. That's really real. To walk into a room, and I'll do it on purpose. Every time a doctor leaves the room, I'll go in there and say, any questions? Because they just won't ask the physician. So to have that.
Yeah, we see it. We see it a lot, and we've gone through the passing of both of my parents, and both cases they both took a different path. My dad's passing was semi-quick. He had an event and ultimately went into hospice a week after being in the hospital and passed a week later. And so, that was one way to see that transition. And then my mom, though, had a different path. She had Alzheimer's, and she had basically a 2-year downslide, decline, and then it just progressed and progressed and progressed until the end. And it's a different emotion for children to see that, and we definitely impart that to our nurses. And the wonderful thing that we've been blessed with, and you see it, I'm sure, every day in your line of work. Nurses are great people, and we've been blessed to have fabulous nurses join our service. They're empathetic, they're skilled, and they just want the best for their clients.
I think I read something the other day that said that the field of that nurses once again were voted the most trustworthy of any profession.
Absolutely.
And so,
well, it sounds like you take care of them. I think like when I joined that other company, it didn't really feel like I belonged anywhere. It was very hard to care for the company when the company didn't really seem to care about living up to its word or what my schedule is. So I just never worked for them. I just stuck to what I was doing, and this never happened.
What we have learned, and I'm sure we could have an entire other podcast on this subject. It all boils down to the traditional healthcare insurance model is, and at the end of the day, the reimbursement drives everything in the traditional health model. Everything that we do is cash pay. We don't take insurance, specifically because we don't want to be beholden to where does care begin and end based on what the reimbursement is. And it does allow us a lot more flexibility to say to our nurses, take all the time you need. The client is paying for this because they want it. And it's a beautiful model.
Yeah, sounds like it. So Scott, you mentioned that you have personal experience with hospice. Amy, you were working in hospice. I always find that nurses who work in hospice, and I'm directing this to you, Amy, there is like a very personal connection. It's not a field that just anyone says they want to go into. Was there any personal experience that you had with hospice?
yeah, absolutely. And I think you're right. I think most nurses, caregivers, chaplains, counselors that go into the hospice field just have like a special heart for hospice and end of life care. And, for me, it was watching my grandmother pass and watching how amazing the hospice team, it was in Atlanta, Georgia, was with her through end of life, and just seeing that and what a special time it was to be there with them, and all the amazing things they're able to do to come in and help through that it's a very intimate time in a family's life. And so that was definitely when I first had my first experience with hospice, and I was at that time in the hospital doing nursing. And that's when I first said, this is something I think I'd like to look into and go into. And, I met with the local hospice team in Savannah, and they said, we think you would be great in admissions for hospice, which is a neat spot because you're the first person that a family talks to when they're going through this, and so that experience allowed me to see how much help families need navigating it all.
When you were working in hospice and you were going into your own business, what were the bread and butter things from your experience that you said to Scott, like, we need to take care of these things. This is what I don't like. This is what works.
Yeah,
we absolutely have to cover this ground in moving forward.
Absolutely. I knew that I really wanted to create a company where you could take the time necessary to really help people. So hospice is absolutely wonderful. What they do is wonderful, but families need more than they can offer, because it's also insurance driven. It's also a nurse only has an allotted time to be with the family before they have to get to the next patient, before they have to get to the next patient. And, families need a lot of help understanding, dealing with this and understanding it. And so I wanted us to create something where we could give that to families, just like Nope, not worried about insurance. We have all the time in the world. Let's look at all the different pieces of this and help you navigate it.
And you know what we saw, and I'm sure you see it every day. You know, in Savannah alone, I'm sure in Long Island there are a lot more, but in Savannah alone, there are 23 hospice companies. So what we're going to be the 24th? I mean, what were we going to do different, right? The model is dictated by what Medicare, will reimburse. And so for us, it was, all right, we can't fix that model. There's nothing we can do about that. Everybody else is trying, big, business, Wall Street's trying, everybody's trying to figure out how to change that. So let's do it differently. Let's go after the gaps. Let's look at what people aren't getting from that traditional model and create that.
I would even say it's supplemental to what they're doing.
Yes.
And so we
don't replace it by any means. We don't even try.
We actually, like to say that we are like hospice care support. Like
yes.
we'll go alongside a hospice company and support the wonderful work they're doing with, more caregiving, because a lot of times people see hospice coming on board and they think, okay, well, there's going to be somebody here with me all the time now. And that's
I've got hospice taking care of it.
That's just not true. The hospice nurse is going to come once a week, and they might send a CNA once a week for a shower. Families need a lot more than that, so we're able to supplement in the caregiving around the clock if that's needed, more nursing support with our nurses as well. And, one thing you mentioned earlier was patients needing to go into the hospital for IV fluids or something like that.
Or IV medication,
IV medication, that is something too we're able to offer at Coastal Care Partners through private duty nursing. So our nurses and nurse care management act more as an advocate or consultant. But what's great is that we can also flip to private duty nursing, so we can do IV antibiotics at home, IV fluids at home, wound care at home. All of these like traditional nursing skills could also be done at home and keep them out of the hospital.
And the way the licensing for that works here is just get a doctor's order. So if they've got a doctor and we call their doctor and say, hey, listen, your patient is, exhibiting this. The doctor say, okay, I'm going to send over orders for you to do this, that, and the other private duty. And it's a beautiful, setup there when we can just pivot the nurse cap from, advocate to actual hands-on nursing.
Yeah, it sounds like things are flowing. I think that's the biggest frustration with providers, nurses, or physicians or PAs. It's just that feeling of stagnation. You just want to keep things moving. You want the treatment plan to move forward, give this med or see this specialist. And when someone's stuck waiting for a procedure or they're in the emergency department for too long, anytime they can get IV medication at home, especially a lot of times they might be in the hallway. You only have so many treatment rooms. And so now you have your father or mother or whomever, they're in the hallway getting, IV medication, and who knows who's walking by. And
absolutely.
Yeah, that sounds amazing. What you're talking about. You're not inhibited by the insurance.
Right.
Yeah, I have a surgeon buddy, and you want to talk about how powerful the insurance companies are, and you want to talk about like I don't know, call it bullying. In the physician's lounge, they have every physician, every surgeon on the wall, and the cost of how much it's cost the hospital so far. And then you have these watchdog groups that are like, why did you spend this much money on anesthesia? And the answer is, well, because the patient needed it. Or why did you use this much pain medication? It can definitely, it certainly shapes care. And it's nice to hear that this isn't slowing down, impeding the treatment for your clients.
Yeah, it's been a blessing for us, and the community here in Savannah has really embraced what we're doing, and that's been great. So I mean, we love it.
Yeah.
You started this in 2021, right? I think we were speaking.
2018.
2018. Okay. This is a clientele that we're all going to become one day. Is there any questions or anything you wanted me to touch on? that I haven't as
No,
of yet?
I mean, Glenn, I think you've covered it. Your questions are really good because it opens up. One of the things that we struggled with when we were first coming up with the model is is translating the service to the layperson, to anybody out there. How do you sell it, right? And because we all know that healthcare today boils down to your $40 deductible. I mean, that's all people know about their healthcare. And so when we were starting the company and we said, all right, you can hire a nurse, private pay, just like you hire an attorney to do your legal stuff, an accountant to
Right.
do your taxes, you can do all that. And this nurse will be your private care manager. People were like stunned. They're like, what? I can
Yeah.
hire a nurse privately to manage all of this stuff. And we're like, yeah. And so that was the biggest challenge for us to begin with, was figuring out how to get people to understand, that there's more out there than just, the $40 deductible for insurance and your health care. That was probably the biggest thing for us. Anything that we're missing? I think he's been all over it.
I think he's done great.
Yeah.
Well, no, because you just remind me, if you haven't been through it before, a loved one going through this stage, I think it's probably one of the most surprising, disheartening, enlightening, overwhelming experiences that you will have in your life. Just to go to a hospital from waiting, you got that CAT scan, you might not get results for 4 hours. You might find out two or three things you weren't even aware of. You might be dealing with a physician, and then there's a shift change, and you don't you don't know. It might take an hour for the onboarding physician to even speak to you and to catch up with what's going on. The nurse might change, and any number of things might occur. You might want to leave, and then maybe your father starts sundowning, and
Mhm.
you're a little concerned about um, how often those checks are happening, or is that food going to come? There's so much more than just the medical side that I don't think people understand.
We
That
see it every day in our business. It's funny, we send the caregivers or the CNAs, right? So not the RNs, but the CNAs, and they sit with the clients at home, and we'll be, caring for someone for 3 or 4 or 5 months. And then all of a sudden they'll have an event and they'll have to go to the hospital, and we'll get the call from the son or the daughter, whoever's paying for the care. And they'll say, hey, mom's in the hospital. We won't need the caregiver to come to the house tomorrow or Friday. And we're like, time out. You need the caregiver to go to the hospital. And they don't really get it. And we have to work them through exactly what you're saying. This isn't 1970 where the hospital was very pristine and there were nurses just falling over each other, running and walking around the halls.
Yeah.
It's a different world
different
today,
world.
and you need that bodyguard. You need that caregiver with them, not because the nurses aren't doing their job, not because the doctors aren't doing their job. It's because the whole system, the environment is just different than it was, and it doesn't allow for that
doesn't allow.
extra time that all of these wonderful professional clinicians would want to give your loved one, right? And so, we see that a lot.
It's difficult. You can you might be on a rapid response team and get somebody who's coming in for cardiac arrest or some kind of trauma that might take a lot of your time, and then you have two people coming in with chest pain and a stroke alert. Another stroke alert comes, and you have a patient with substance abuse disorder who's just maybe going through withdrawals, or um, and a nurse is going to live and die by the triage about who is the most, I don't want to say important, but who is the most on the brink. Who do I need to? And a lot of times people get frustrated because they might come into the ER for something routine, and they think like this is an easy thing. I should be in and out, and they don't understand that. Yeah, you're here for a relatively simple issue. However, you're in competition with people who are
Yes.
really
Great
going
word.
through it.
Great word.
And so in the case of what you're providing, maybe the family member doesn't have to be there the entire time. They can feel safe about stepping out and kind of being filled in by the advocate. What's some of the trepidation that you get from people who are maybe they haven't acknowledged yet that hospice is where they need to go? What are some of the concerns? What do you think are some of um, the factors that make people hesitant, or maybe even denying that this is something that they need, that hospice is where they're at in their care?
Yeah, sure. I mean, it's scary to talk about hospice, and talk and think about end of life. And it's scary for the patient and for their whole family. So that's totally natural. But what we tell patients that are in this position is that being in the hospice program doesn't mean you're going to die right now. Hospice, people can live for years in hospice. And I've even seen there are even the hospice companies even have graduation parties when somebody does get better. Hospice is added
That guilt
support.
factor probably comes in, like, oh, hospice, it's like, I'm giving up on my mom or my dad, or it's
Yeah,
not
all
giving
of
up
that.
on anybody.
No, it's
You're
just
maximizing what, like you were saying, you can come out of hospice, but if you need hospice and you perhaps ignore it, then the a negative outcome may be inevitable.
absolutely. And some of the wonderful things that hospice can do is with palliative care and things like that. They can add things to help with anxiety, help
Right.
with pain, take away maybe medications that are actually more causing more harm than good. And there's just a lot of natural things that hospice is able to help with holistically for the patient and the whole family.
Maybe change the route of those medications. In the example I was speaking of, when I heard about the pain meds that were prescribed and the dosage and how they were taken, I was like, I don't think those are gonna work for her. I don't think, even the way she's taking them, I don't think they should be even PO meds. I think, and it was, my nurse's brain was going 1,000 miles an hour, thinking of all the possibilities. Something that a husband or a child not in the medical profession wouldn't even think about. It was just kind of like, okay, whatever you want, I'll give it. Almost like a one size fits all from their perspective, which is obviously not the case.
Yeah, exactly. And one of the beautiful things about our nurse care management program is that our nurses are able to go in and just help families understand all of this and sort of help lead them down that path so that they can, see that. And it's just very helpful to have that nurse that you've developed a relationship with and trust come in and help you understand everything going on and help you navigate it.
Well, Amy and Scott, thank you so much for doing this. Coastal Care Partners, that's your company. It sounds like you're doing a lot of good out there in the world, advocating for patients, advocating for families. I'm honored to have you come aboard and talk about this subject that is scary for all of us, even those of us who are taking care of these patients.
Yeah.
Oh, thank you so
Absolutely.
much for having
Thanks for the
us.
opportunity.
We've had a wonderful time talking about, Coastal Care Partners. We've been so blessed, and the community here in Savannah has embraced us, and we're so grateful.
Yep. Thanks a lot.
Thank you. Hello, folks. I hope you're enjoying the interview. Before we go back, let me announce I wrote a children's book, Isabel Learns to Share, a love letter from me to my firstborn daughter, Isabel. It's available on Amazon, but let me be clear. In a world of AI, this book is written by me, every word of it. Everything this book earns goes right to the podcast. This book emphasizes family values, respects parents, and respects children as they go through life making mistakes, but ultimately learning how to become their best selves. Click the link down below, support the podcast, and get yourself a copy. Thank you very much.